There's a serious myth that has infiltrated the world, and that is estrogen causes breast cancer. On this episode, I'm going to share with you the truth about estrogen, and it's not what you think. I'm Dr. Jake. I'm a naturopathic doctor and integrative physician. On this channel, I share with you how you can heal your body down to the root causes and get your health back. Make sure to subscribe for more videos like this one.
You're watching the Dr. Jake podcast.
So, what is the current mainstream belief regarding estrogen and breast cancer? The mainstream belief is if you take any type of estrogen, you're going to cause yourself to get breast cancer in the future. And that is way too simplified and not totally the truth. Where did this belief come from that if you take estrogen or you do hormone replacement therapy, you're going to get breast cancer? So, this came in a nurse's health study that did an epidemiological study. They checked patients over a 30-year period of time, and the results came out late 1990s, early 2000s, I believe. And it stated in there, and they left out all the other data in there. They just stated, hey, if you're taking hormone replacement therapy, we're seeing that you're having an increased risk of getting breast cancer. So this totally changed how all doctors were practicing, and they stopped giving women estrogen for their menopausal symptoms or many of the other symptoms that they're experiencing from having low estrogen. And it has greatly affected the lives of many women ever since this time. What is the problem with this statement that estrogen causes breast cancer is that it's too simplified. They did not go in detail on this enough. This was just looking at women that were taking hormone replacement therapy, and they were just looking at them and saying, okay, did you get breast cancer or not? And that's all they did. And they saw an increased risk. But they left out a lot of things here. How much estrogen were the women taking? They didn't look at that at all. Were they actually testing the value and how much estrogen the women had in their bloodstream and see if that was correlated with the risk? Was it in a more bioidentical form, meaning it's in the form that looks just like our own estrogen, or is it in a more synthetic form that has a little amino acid attached to it or coming from horse urine? They didn't look at it in that way. All they saw is, okay, you take hormone replacement therapy, you're going to get breast cancer. And that's not good enough for us to really understand what is going on. And one thing that they left out, which is very interesting, is when we think of breast cancer or cancer in general, is we're going to die younger. That's what we're scared about. But what they saw within the study is women that were doing hormone replacement therapy were actually living longer. They had a 30% decrease of total cause of mortality. Because what we see with women that have a good level of estrogen is their Alzheimer's risk go down, their cardiovascular disease risks go down, their fracture risk goes down because estrogen builds bone, and many other health benefits that come along with having estrogen, the anti-aging effects that come along with it. So all we did was pick out one negativity and change the world on estrogen when estrogen is such a good, healthy thing if it is prescribed appropriately. In the data, if you're living longer, you're going to have an increased risk of getting any form of cancer because the older you get, the more likelihood you're going to get cancer. They were seeing that it was coming along in younger women too. So it wasn't just coming along in the older women. And women were getting more breast cancer when they were doing the estrogen. But again, like I said, they just weren't looking at things appropriately and just looking at just one thing and not the whole picture. What have we learned about estrogen and the different effects that estrogen has on our health? Are there bad estrogens? Are there good estrogens? Is there a certain dose that you're supposed to be taking that's actually beneficial to get the anti-aging benefits and you're not going to have an increased risk of breast cancer? So let's talk about this now. So let's talk about dosing to start. So whenever I am testing a woman that is on bioidentical hormone replacement, this is all I prescribe. I don't do hormone replacement therapy. Bioidentical is using the exact form of estrogen that your body would naturally make, and you prescribe it at the dose that your body physiologically would make it. So I check a blood test and I see where the levels are in the blood of estradiol. And I want it to be between 30 or 50. In this range, you might have a mild risk if you're really at risk for cancer, but usually not 30 or 50, and you're going to get the anti-aging benefits that come along with that. So we want to make sure that it's in that range, and I don't really go higher than that because we're going to maybe increase our risk of cancer. Again, in that nurses' health study, they didn't check that at all. Women could have had 200, 300 levels of estrogen. We have no idea. And yeah, of course, that's going to cause increased risk of breast cancer because a lot of breast cancers can be estrogenic, but it's about the dose that you have. Also, it matters about the estrogen and how the estrogen is made. We have three different types of estrogen. Okay. We have estradiol, we have estrone, and we have estriol. Estradiol is the strongest of them all, and it's going to have a much stronger effect on the cell receptor. And it also has greater risk of causing DNA damage in the mammary gland, leading to cancer. Then we have estrone, which is still a bad guy, but really nothing as bad as estradiol. It's 10 times as potent, but it can possibly cause mutations in cells and lead to breast cancer. And then we have estriol, which doesn't increase your risk at all of getting breast cancer, and actually has some research of actually possibly preventing breast cancer in the future. So they're all different. It's not just estrogen, it's what form of estrogen you're taking. But also, let's dive into there's three different types of estradiol and three different types of estrone. We have estradiol that's made from our ovaries. And then we also have some of it gets made from our adrenal glands, but most of it gets made from our ovaries. It gets released and it goes into our bloodstream. And then it goes to our liver. Most of it is metabolized in the liver. Some of it goes to our uterus. Some of it goes to our mammary gland. And then what happens there is it gets conjugated. It changes. And it gets converted into what's called 16 hydroxy, 4 hydroxy, or 2 hydroxy estradiol or estrone. 16 hydroxy is the most damaging, going to cause the most DNA damage. We have 4 hydroxy, which is still damaging, but not close to as strong, but still damaging and can cause mutations. And then we have 2 hydroxy estradiol estrone, which is very weak and actually acts like a soy isoflavone, or that is a very weak phytoestrogen, is what 2 hydroxy estradiol acts like. So what we really want is get all the health benefits of the estrogen, but we want the estrogen to be made in the good stuff, the 2 hydroxy estradiol. We don't want it in the 16 hydroxy or 4 hydroxy. And that all depends on our health and what we're doing and what we're eating that will affect how the estrogen is made in our body. What would cause a woman to make too much 16 hydroxy or 4 hydroxy? A big one is if you have fatty liver and also if you are obese. That's probably the biggest one. And also people that are eating the SAD diet. They're not eating a lot of fruits and vegetables, and especially they're not eating enough cruciferous vegetables. Cruciferous vegetables is a huge thing to help make more 2 hydroxy estradiol, the healthy one, and decrease the 16 and 4 hydroxy. So you need to lose weight and you need to start eating a good diet that is high in fruits and vegetables. That's the big one that you really need to do, and take care of your liver. So how do you know if you have this bad estrogen in your body or not? So it is pretty simple. We could do a blood test or a urine test. Many times it could be even a little bit easier to get the 16 hydroxy, 4 hydroxy, and 3 hydroxy through what's called a Dutch test. We can do this just through basic LabCorp labs to really go dive in detail of the certain type of estradiol that you are making. And we could look at specifically estradiol, your estrone, and your estriol. And we could look at all that to really know if we need to make some modifications to your diet and take some supplements to help. Let's talk about estrogen dominance. I don't like women to be estrogen dominant. It's definitely an issue. And the big thing is you actually don't have a right balance of your hormones. You have way too much estrogen compared to progesterone. And if you do have way too much estrogen compared to progesterone, that is going to most likely, based on the research, increase your risk. It doesn't mean you're going to get breast cancer, but it does increase your risk of getting breast cancer. So you do want to balance out your estrogen and progesterone ratios. If your estrogen is way high compared to your progesterone, you need to go to an integrative physician that really knows how to balance that out appropriately. So it will decrease possibly your breast cancer risk in the future, but also just help you feel better. Because if you're estrogen dominant, many times you're going to be anxious. You're going to get headaches often. You're going to be water retention. You're going to gain weight. You're not going to be sleeping well. All these symptoms can happen when you're estrogen dominant. So yeah, go to the right doctor and get that balanced out. Are there any supplements that you can take to actually help you make the good estrogen and get all the benefits that come from estrogen and not any of the mal effects that can happen from estrogen? Yeah, there's a lot of things that we could take. So one of my favorite one is called indole 3 carbinol, or DIM, diindolylmethane. very similar things. DIM's just two endo 3 carbonyls attached to each other. But there is research showing that this will help make more 2-hydroxy and decrease 16-hydroxy and 4-hydroxy estradiol. So just taking that one supplement can really help a great deal. And many times when I prescribe women bioidentical hormones, I do prescribe diindolylmethane or endo 3 carbonyl help with that. Also, really the next thing is you don't have to take a supplement. You can take like broccoli extracts and things like that, or you could just eat a lot of broccoli. But if you're like, I don't like broccoli and I'm not going to eat a lot of it, you could take a broccoli supplement or something called sulforaphane. That has a lot of good research helping making the good estrogen also. And then you want to be eating the good, healthy flax seeds with high amounts of lignans in there. That helps make the 2-hydroxy more than the bad estrogens also. And then I'm just going to put a little plug in there. And to help do this is you need to be exercising. A lot of good research of if you have a good aerobic and anaerobic exercise, that's going to help make good estrogens in your body too. What do I do for a woman that has low estrogen and wants to get the benefits from all the estrogen, but she doesn't want the breast cancer side effects that could come along with it? So the big thing is when I put someone on it, I'm doing it bioidentical form. So I'm prescribing it appropriately. I'm doing it in the form of estrogen that looks just like it does in your cells. I'm also prescribing it not just estrogen by itself, because we just talked about the estrogen dominance. We don't want to make you estrogen dominant through our prescription, right? So many times we're giving you estrogen and progesterone. We're also maybe giving some testosterone and DHEA to really balance out your hormones appropriately. Also, many times we're going to give you DIM. We're going to make sure that you're exercising. We're going to make sure we help get your body weight under control. And we have you taking flax seeds. And we check your blood work and make sure that it's not too high. I'm never going to let your blood work go too high to increase your risk. I'm going to keep it in that 30 or 50 range, maybe even lower, because some women's receptors are very sensitive and the blood work isn't perfect. Some women, their receptors are sensitive and they're going to have more of the estrogen effects happening in the cells, so they have side effects from the estrogen. So we go even lower than that 30 or 50. So that's really how we do it healthy, and you get all the benefits that we just talked about with estrogen, and really decreases your risk of getting breast cancer in the future. If a woman has breast cancer, should she get on an estrogen blocker? That is a debatable question. Yes or no, tamoxifen will block that receptor. If you have an estrogen positive breast cancer, which they don't prescribe tamoxifen, if you don't, it's going to block that. But like we talked about, there's other things that we can do to make the good estrogens, right? So we can take things that increase that 2-hydroxy, which actually helps possibly prevent breast cancer and not have the side effects that come along with tamoxifen. But it is a debatable issue. You really need to talk to your naturopathic oncologist that really knows what they're talking about and get the right prescription. If you want to get a hold of us, visit our website, integrativemedica.com. Find our phone number there. Give my receptionist a call. You can set up an appointment with me or some of my other doctors. You could also just set up an appointment directly on our website. If you want to learn more about estrogen and other hormones and cancer, click my videos to the right. I'm Dr. Jake, and I'll see you there.